Feel good?
Time to take a quick break.
Eating the water.
Then it's back to the slide and everything this playground has to offer Deidra Jacobs and her 8-year-old daughter.
I can actually run behind her, play behind her, and not have to worry about feeling like I'm faint.
Deidra was diagnosed with a condition called mitral valve prolapse. She learned early on she had a common heart problem that kept her heart valve from closing properly. Millions of men and women in this country have mitral valve prolapse. In some cases, it can cause chest pain, fatigue, and heart palpitations. Dr. Hanny Safin at Florida Hospital is Deidra's cardiologist.
Mitral valve prolapse in a lot of people is a benign condition that does not lead to valve malfunction and does not require surgery. In some people, it causes the valve to malfunction where there's a lot of blood backing up, and that can cause shortness of breath and symptoms of heart failure. And then when it becomes severe with symptoms, that would require a surgical intervention.
A few years ago, Deidra and her cardiologist noticed her symptoms were getting worse.
I had symptoms, shortness of breath. I was getting tired earlier, going to bed earlier than normal. And I'm thinking, here I am in my teens and my 20s. I should actually be enjoying life and not having to worry about being in bed or fatigued by 8:30, 9 o'clock at night. But it just started to get worse. I would come home from work and I would just crash.
A test called a color flow Doppler showed blood leaking through the valve. A surgical procedure was necessary. Heart surgeons either replace the valve with an artificial valve or, if possible, repair the existing valve. A better long-term option for patients and something Deidra wanted. Deidra's cardiologist recommended Florida Hospital heart surgeon Kevin Accola.
Yeah, when I first saw Deidra in the office and we talked about the potential risks and benefits and options, I felt we had a very good opportunity or chance to repair her valve.
Just the fact of knowing that my cardiologist spoke with him and told him about the story, I didn't have to repeat myself. So my comfort level was already good, because now here I am the surgeon. We actually have an opportunity now to really get to know each other, and he knows my needs. How are you?
It's several weeks after Deidra's surgery. A decision made as a team, Dr. Accola, Deidra, and her cardiologist.
But it's always a collaborative effort, and again with the idea in mind that we put our heads together and collectively decide or determine what's best for that particular patient.
Ready? 1, 2, 3.
Deidra feels the surgery was best for her.
That's all I can do.
It gives her a chance to feel like a kid again with Shania.
I know now when I come home, I'm not, going to bed. I'm not feeling tired. I can sit down with my daughter. We can, have a nice day outside. We can play. We can ride bikes together. It's just an important time for me, because now I can live day by day and know that I can enjoy that opportunity with her that I did not have the last 4 or 5 years.